to talk about the stages of herniated disc healing. The lumbar disc, so the lower back, the outer part of the disc is called the annulus fibrosus, and it is made out of collagen. It's a cartilaginous structure. A herniated disc is just where the inner part of the disc, the nucleus pulposus, pushes out through the annulus and herniates, and it can irritate a nerve root. It can have sciatica. The nerve root may not be irritated, it just causes lower back pain. Whatever the case may be, there are specific phases of the healing process, and this is well documented in the medical literature. Now, the timeline for these phases overlaps and varies widely, and we also need to consider the difference between using imaging, MRI imaging, to determine if a disc is healed and just determining clinically if a disc is healed. So clinically, without imaging, we consider a disc healed when a person is asymptomatic, they have no symptoms, and they have returned to their prior level of function. They're doing the activities they want to do that they could do before the disc herniated. And when you look at the medical literature, when they're determining if a disc is healed, they're looking at MRIs. So somebody starts to have lower back pain or sciatica or both, they do an MRI, they say, oh, your L4-5 disc is herniated, and then they're doing repeat MRIs over time, seeing if that herniation shrinks or goes away, and then using that to determine if the disc is healed. So these are two different things. You can have a herniated disc that stays present on an MRI. It's herniated, it stays there, never goes away, and be completely asymptomatic for years. I would still consider that a healed herniated disc because it's not impairing your function at all, you don't have any pain. And another thing to keep in mind is not all herniated discs do heal when you consider only imaging. So a lot of people have herniated discs that give them pain, give them issues. They rehabilitate the disc, they're fine, they don't have any symptoms, but when you look at their MRI, they still have a herniated disc. It's important to note that herniated discs that are the most severe are the ones that are most likely to shrink in size. This is called spontaneous regression or spontaneous reabsorption in the medical literature. So sequestered discs are ones where the nucleus pulposus, the inside of the disc, comes out and is just sitting out there. Those are the ones that are the most likely to spontaneously regress or reabsorb. Herniated discs that don't push all the way out and separate from the annulus, from the outer part of the disc, while they can shrink in size and be reabsorbed, it's just less likely to happen, and it's important to keep that in mind. There are 3 to 4 primary stages of herniated disc healing depending on what literature you look at. But the first phase of herniated disc healing is the acute inflammatory phase, and this typically lasts from 0 to 2 weeks. So from the disc herniates up to about 2 weeks. Now for some people it may only last 3 or 4 days, some people it might last 3 or 4 weeks. Keep in mind there's a large variance between individuals as far as these timelines go. So if you don't match these timelines perfectly, don't worry. This is just to give you a general idea. So the acute inflammatory phase, we're going to say, is that first 2 weeks after the injury, after the disc herniates. This is when you're going to have the most pain. If you have sciatic symptoms, they're going to be the worst. If you have just lower back pain, it's going to be the worst. This is when you're probably going to be on NSAIDs, muscle relaxers, pain pills, if needed. You're modifying your activity levels, you're figuring out positions where you have the least amount of pain, and you're just trying to get by. Now, from 2 weeks to 8 weeks, this is the tissue repair phase. So this is when your body starts to get rid of injured tissue and lay down new tissue. This can start as soon as the second day after the disc herniates, after the injury, but we're going to say it's that 2 to 8 week range, and it can last after that 8 weeks also. But that tissue repair phase is typically 2 to 8 weeks. As far as the disc is concerned, the outer part of the disc, the annulus fibrosus, it's made out of collagen, and the inside of the disc herniates and pushes through that. So your body's laying down scar tissue that has collagen along that annulus, and it's healing. So 2 to 8 weeks is that tissue repair phase. And then from 8 weeks to 16 weeks, that is what's called the maturation remodeling phase. And what happens during that time is that tissue that has been laid down during the tissue repair phase, that tissue starts to become stronger. It starts to mature and remodel. And that happens with loading. So it's really important during that 8 to 16 week time frame that you were doing some sort of specific rehabilitation program for your spine, because that's when you're going to really get that tissue as strong as you can and build a strong, rigid base, a strong pain-free spine so you can function at a high level. Now, that maturation remodeling phase, that can last for months all the way up to over a year. We're saying it's 8 to 16 weeks, so 2 to 4 months, but realistically it's gonna last beyond that. So, and during this time, most people are much better. So they have a lot less pain. If they do still have pain, it comes and goes. It's not as severe. It's much more manageable, and they can pretty much function. And this is when we like to see people return to the regular activities, you do whatever it is they want to do and not have any restrictions. And then after that, some people will say is the long-term management phase. So that's where you could have a fourth phase. But really, you've got the acute inflammatory phase, that's number one. Then number two, you have the tissue repair phase. And then number three, you have the maturation remodeling phase. And those are the three primary phases. And then if you want to have a fourth phase, you can say, okay, that's the long-term management phase. But that maturation remodeling phase, like I said, that could last over a year. So really, there's three phases, and each phase involves different aspects and different levels of function and different levels of pain. If you have any questions on the phases of herniated disc healing, drop me a line below. If this video helps you, give me a thumbs up.